Good morning, everyone. Welcome to day 2, session 4 of the 2020 Wisconsin Infant and Early Childhood Mental Health Conference. I hope this morning finds you all well, with a full cup of coffee and ready to start our session with us today. We're so happy to be with you and to share this information with you. Know that even though we can't be in person, we're keeping you all in our hearts and our mind, and we're so excited for you to join us today. I am Jenny Durand. I am the Professional Development Coordinator and Southern Region Pyramid Model Lead with WeAIM, and I'm excited to be in on this session this morning and to start off our Tuesday in this way. So some logistics as we get started this morning. Our webinar will run for approximately an hour. And then we'll have some moderated question and answer time afterwards. Please type your questions in the Q&A box and then use the chat box to connect with each other. Also, throughout the session, our presenters today will have a poll, and they will cue you when to answer those questions. As you can see, it just appeared in your chat box right now. So if you want to click that link and get yourself situated to engage in that poll, go ahead and do that. I will also be sharing that link throughout as those parts of our session pop up with us this morning. At the end of their time, I will be the spokesperson for your questions, and I'll be grouping similar questions to ask them as well to round out our time together. Again, thank you for joining us. We appreciate and looking forward to this next hour for us to be connected virtually. We're very pleased to bring you this panel from the Wisconsin Office of Children's Mental Health, who will introduce themselves, and they're going to share more information about the lived experience of leadership. Where to begin?
Thank you, Jenny. So good morning, everyone. My name is Andrea Turtenwald. I work for the Office of Children's Mental Health, and there I serve as the Family Relations Coordinator. Today, I'll be walking us through the session on lived experience leadership and where to begin. A little about me: it's my full-time job at the Office of Children's Mental Health to bring people with lived experience to systems change work. And I also identify as a person with lived experience in mental health. Aside from that, I have a background in child welfare case management, social emotional learning programs, parent empowerment work, and I also have a 14-month-old at home. So that brings me all kinds of joy and additional lived experience to this work. And today you'll hear from a few parent leaders who will be joining us. So I'll have them provide a brief introduction now. So Rachel, why don't you go first?
Hi, I am Rachel Zwicky, and I am a lived experience leader with the Office of Children's Mental Health. We have lived experience with autism, PTSD, anxiety, adjustment disorder, and suicidal ideation. We have utilized counseling, psychiatry, neuropsychology, neurology, neurosurgery, day treatment, special education. So a lot of lived experience with services. I also am a parent peer specialist with Wisconsin Family Ties. And prior to this work, I was actually a counselor, but I've moved more in this direction because I really appreciate being able to emphasize family voice and choice.
Awesome. Thank you and good morning. Thanks for being here. Jane, go ahead.
Yeah, hi everyone. Excuse me. My name is Jane Stueber, and I prefer to use she, her pronouns. I'm 25 years old. I grew up in Green Bay, Wisconsin, but currently live in Milwaukee County, Greenfield area. I graduated as a first-person generation college student from the University of Wisconsin-Milwaukee with a bachelor's degree with a double major in social work and American Sign Language, and then a double certificate in LGBT studies and cultures and communities. My connection is unique to children's mental health because I live with depression, anxiety, and PTSD. I'm also a foster parent with my wife, and we got licensed in June of 2019 and have had 9 kids in our home. We are technically a level 2 home. However, we've had almost all level 4 children, and we receive a lot of services such as WIC, and depending on the needs of the children, different types of therapy like occupational therapy, counseling, caregiver support for my wife and I, and then along with the rest of the appointments and requirements through children's and all knows what. So it's been a fun adventure, but you know, we get there through.
Yeah, Thank you for being here. And clearly, I think from these two folks alone, there's a lot of wealth of experience just here. So thank you both for joining us in this panel. So for today's session, I just wanted to keep this really straightforward. And what's more clear than these kind of key questions? Who we are, who do we mean when we talk about lived experience? That will be sort of our first approach and what we'll talk about. What does that leadership piece look like? How do we as advocates, caseworkers, and professional stakeholders manage the when and where so that lived experience leadership can promote equity, responsive programming, and family engagement? We'll be talking about all those different things. And the big piece is the how, right? How can we set up practices to create effective partnerships with lived experience leaders? What tools are available to help us? And how do we move beyond the challenges with engagement? So we'll be exploring all of these things and really relying on our parent panelists here to also be providing that insight. As Jenny mentioned at the intro, we'll be using Poll Everywhere as a means to stay engaged with you all. Again, we're in this sort of weird virtual world, but normally at an in-person conference, I'd be like pointing at people and having people raise their hands and share. So this is our attempt at really trying to create some back and forth engagement. So you can join us either via texting by texting OCMH627 to the number 22333, or you can click that hyperlink that's in the chat, and that will take you to a website where you can be participating with us. So, and I see folks are already sort of answering here, which is fantastic. What's your vision for the work that we do? What do you hope to achieve? So I'd really like you to consider those things. Is it that, you know, children get the best start possible, or that families are safe and supported? What is it in your work that's really driving what you do? So take some time to think about this question and send your response in Poll Everywhere. The question will be up for a few slides as we are going forward. We're going to say a little bit more about who we are. So the Office of Children's Mental Health is part of the state government, and we report directly to the governor. We are a small team who prioritize research and data, collaboration, and lived experience. Our vision for the work that we do is to see all children are safe, nurtured, and supported, and that systems are family-friendly, easy to navigate, equitable, and inclusive of all people. But you know, we're not actually there yet, right? Like we still have some work to do to achieve that vision. And the way the office tries to achieve that vision is through collective impact. Collective impact is an approach that brings State Department representatives, advocates, mental health and medical professionals, educators, and people with lived experience all together regularly, so we can be focused on the issues that are impacting kids and families in our state. Talking about collective impact and the work of OCMH could honestly be a whole separate hour conversation, but I know that's not what you're here for today. So that's pretty much my short intro that I'll provide. But if you'd like to learn more about this work, you can go to our website at children.wi.gov to read a little bit more. So let's hop back to this vision. Essentially, like, what is your why? You know, I'm seeing to support providers so they have the best resources, to ensure access to high quality early child care or early care. Children enter formal school ready to learn. Parents feel empowered and confident, empowering families, being a resource and a change agent. I love seeing all these answers. Parents can see children's cues and then compassionately meet children's needs. This is awesome. Yes, children and families get the best start possible. Well, I love this. And as the answers keep rolling in, again, I continue to have you do some reflection for yourself. I'd love for our parent leaders to share, why do you serve as a leader with lived experience? What is your why behind this work? Jane, yeah, go ahead.
I do this work because I want to continue to see the stigma of mental health decrease. I know we were doing like a youth listening session a couple months ago, and like just hearing how broken our system was really hard to just take in. But mental health is not a weakness, and one does not need to be forced on medication. And like mental health is, we learned, is not contagious, and that's, I think, is a huge myth when we talk about mental health, but people really need to be aware of it because it needs to be different, and by talking about it, it'll make a difference to others. I'm here to share my story and inspire others, and if I made a difference with just one of the individuals, my time is worthwhile here. I think my story is not only impactful to my own because I lived through it, but like, again, just sharing that I think is huge. I serve as a leader through the Office of Children's Mental Health because having a voice and being heard is so important, especially with lived experience. And just bringing that to the table, but people really need to advocate for the children, and they need to be safe in homes because that's not something they always have, and that stability. I am here as a minority, so I understand where these kids are coming from and some of the families where they're at. So working together is important so things can get done, and hopefully that process is a little easier and more accessible.
I love it. Thank you for sharing that, Jane. Rachel, do you want to share your why? What's your why that you're at this table?
Yeah, so I've both seen firsthand with my own family and then also with my clients that I had served. There are a lot of barriers that exist that make it difficult for families to get the help that they need. Some of the biggest ones that jump to mind are families not having a voice, not feeling empowered, feeling like they get stuck in a system that doesn't understand them and doesn't do much to help them. I also live in a rural area, so access is a really big issue here. Unfortunately, it still continues to be a reality. And so similar to Jane, I want to help reduce that stigma and increase understanding of what it's really like for families, and just a lot of advocacy work. I joined my local school board for the same reason. I'm one of those people that I don't like to lay down when there's a fight. I like to stand up and like hear my voice. So my hope is that I can, through this work, help other families to navigate the system more successfully than what we were able to, and with more understanding and more empathy.
I love that. And I'm seeing a lot of kind of shared reasoning in our answers here as they're popping up too. I'm seeing a lot about helping families thrive and learn and be supported, having high quality care and like high development and services for families, and helping families advocate for themselves and increase family involvement. So I think that's saying something, that our family leaders have the same kind of vision as our folks who are here at the table hoping to support family leadership. So I'm going to keep moving on, but I'm so appreciative of all these answers. So when we're talking about who, I really want to take a moment to talk about who are these lived experience leaders. So impacted leader, lived experience, you might have heard those terms. Other terms could be community leader, wounded healer, context expert, family leader, or consumer. Children's Mental Health Collective Impact has created that definition that's italicized here on this slide. And really for us, when we're talking about lived experience, we're talking about people with firsthand experiences with mental health, substance use, trauma, or special needs. And their participation in system change efforts is really where the magic happens. So this is just a compilation of some pictures of past and present lived experience partners. For us, a lived experience partner is someone whose age is 16 to 26, who identifies as having mental health, substance use, or emotional needs, or they are a parent to a child any age who has experienced those mental health, substance use, or emotional needs. All these individuals have passion and ability to attend meetings and offer their insight. They all have unique stories, and many have a myriad of acronyms and diagnoses that portray them or their children. And though we have two brave panelists with us here today, that doesn't even begin to capture the expertise and invaluable perspective of every family member interacting with our systems. They may be the parents who keep calling and do not stay quiet, kind of like Rachel, like not laying down, like who's calling and really, fighting for what they need. Or they may be the folks who are quietly answering every survey that you offer, or replying to those emails, staying engaged. They are leaders in their community, but to you, they may just be another family that you serve, but they can be so much more than that. And one thing I like to note here is that I recognize that it's likely there's a lot of folks here in this virtual room of ours that have a personal connection to children's mental health and well-being. And that's a big part of what motivates us. I mean, I'm one of those people as well. And it's just important to note that we all wear multiple hats. So some of us may be parents and employees and advocates and family members and so on. So when I talk about lived experience, especially as we talk more about the why, this effort is really about changing who is at the table. In this work, we really try to raise up the voices of those who would otherwise be left out of those crucial conversations about programs and systems, which means they are not traditional employees in the system. So just something to keep in mind there. So I'm bringing up another question here. How could lived experience leaders help you achieve that vision? Hopefully our who is becoming clear, but you know, for you, we're probably thinking about the parents that you serve and programs and services. So think about that aspiration, that vision you have for your work, and reflect on just how can people with lived experience help you achieve that vision. I'm going to pull a fast one and ask you to explore a little bit more about the how early on, even though that wasn't sequentially where we were going. But in reality, it really is about our why again. And if our why isn't aligned with this work, it can very easily just fall to the side. So it's just really important that we think about the what lived experience leaders can do and how this approach can be replicated elsewhere. So I'm going to leave this question up, but we'll keep talking about that. So the Office of Children's Mental Health Lived Experience Partners, essentially we meet about once a month to connect and learn and strategize and provide consultation to other organizations like the Department of Children and Families or Wisconsin 211. Our Lived Experience Partners participate in one monthly work group meeting on the topics of either trauma-informed care, infant toddler mental health, access to care, and resiliency. So they're a part of these kind of ongoing system meetings. They also participate in our quarterly meetings with the larger network on children's mental health. So again, that can include like hospital staff, school representatives, people from youth justice and child welfare. And they're right there with us at meetings, and they're serving as co-chairs to these groups to help ensure that family leadership is really at the core. The other kind of what that I want to share here is just that scale of what it looks like to have lived experience leadership. There's a lot of different charts and visuals that exist to represent this work, but this is one that I find more straightforward. It really comes down to power. That's what we're talking about here with lived experience. As a field, we may say engagement or involvement or partnership interchangeably, but I do want to spell out the differences here just because I think it's helpful for us to have that kind of shared understanding. Engagement, again, is really just you're consulting, you're chatting with. So again, that often can look like surveys or just informal, like, hey, what'd you think about this? Involvement can look a little more structured. So it might be looking more like a focus group or participation in a one-time committee, something to that effect. And then partnership is, again, really where there's shared power in what is going on in the work. So again, that co-chairing is usually a big piece of it. And there's just that shared understanding of where we're headed, and it's this ongoing partnership. So what I want to say too, before I move past this slide, is that engagement level is not inherently bad. Like, I recognize it is on the bottom level of this, but there are times that is the right mode for participation. And there's other times where partnership is the more obvious choice. So as an advocate, I will always encourage us to move towards partnership. But I will also say that I can recognize that there are times when we just need to get a quick answer on something, and we can't always snap our fingers to partner on everything. So hopefully this gives us a little bit of shared language as we're moving through how to partner with people with lived experience. A quick example I have from the Office of Children's Mental Health, and Jane mentioned it a little earlier. We had tried to hold a youth listening session earlier this year, and so that was, online. We don't have direct connection with young people, so we're like, hey, let's give it a try, see what happens. And OCMH planned the questions, we set the date and the time, and then we asked young people like Jane if they would come in and provide like some facilitation. And we had a pretty good discussion. There were some crickets here and there, but we kind of expected that. A few people spoke up, and most folks participated with short answers in Poll Everywhere. And following that event, our facilitators, we asked if they would help us plan a second session because we saw there was a lot of interest, and we recognized that we really did want to be youth-led on this process. So Jane, we probably met a ton of times, like at least 7 times to plan this second youth listening session. And they really decided on the topic, the structure and the format and the questions that we asked. So we removed the adult keynote speaker, we extended the session and had more time for icebreakers. We had a young person create the whole promotional campaign, so including this picture that you're seeing here. And we spent multiple meetings to ensure that the wording and the questions and the ordering of the questions was engaging and relevant. And at that second listening session, the conversation was so much more lively. There was almost a nonstop line for people to try to speak, and we received so many messages on Poll Everywhere. Afterwards, there were tons of youth who were messaging us and saying they'd like to help plan the next one. And this is just a really small example of how partnership can evolve on every single project and how there can be greater results, better outcomes, and just a more authentic process when we let those folks with lived experience really take more of the lead. So just my last little points on this for the what for system change projects. These are just some examples of what that could look like, whether it's changing or writing administrative rules, setting or reviewing standards of practice, hiring and training staff, developing new programs or evaluating existing programs. Or again, on the quality assurance front, it could be around hosting focus groups, creating and distributing surveys, including on advisory councils, and then providing explanations on discrepancies in data or like the data that your organization is collecting. And this is just a small piece of the network of parent and youth leaders from the Office of Children's Mental Health and what they were involved in 2019 alone. The picture might look a little like hard to read, but all of that text around this tree is just all the different organizations or coalitions or committees that our lived experience partners were connected to. And so it's really just showing that, again, there can be a lot of opportunities and different ways that people with lived experience can get involved at any level of an organization. So I want to bring us back to how could lived experience leaders help you achieve your vision now that we've talked about the what and the how. I'd like, again, for you to keep answering if you haven't already. And so I also am curious if the panelists are up for it. How might you answer this question of how could lived experience leaders help them achieve their visions, like knowing what we talked about thriving and learning and supporting? Do either of you feel moved to think how lived experience leaders could help them achieve it? And it's okay if not, in Jane. This is my off the cuff question for you today.
Honestly, I feel like as a lived experience, I really just want to advocate if individuals aren't comfortable coming forward, like just using this Poll Everywhere and just being able to say what's on their mind and we go forward with that. I think that's super powerful because then everyone's voice is being heard, even if it is only coming from one person, because all perspectives are being shared.
Yeah. Well, and I hear that too, of like creating those opportunities for folks then, so that everyone does have that opportunity to weigh in, whatever way it looks for them. Sounds good. Rachel, anything you want to add? It's okay if not. This is my my off the cuff question.
Not really. I think Jane pretty much covered it. I think just giving people a voice is really important. And a lot of people with lived experience, they don't know how else to appropriately give their voice. So that opportunity is just really important.
Yeah. Well, and I'm hearing the opportunity too as being something more formalized. Like, I think for a lot of folks who do direct service, me being one of those in the past, like it's a no-brainer for me as like a case manager or a direct provider to like offer opportunities for families I serve to weigh in on how are things going, how could it be better. But how can we bring that voice then to the formal structures of where people are making decisions at our organization to make sure that voice is heard. And so I'm seeing a lot of that too in our answer chain here of providing deeper level of insight and avoiding unconscious biases. Decisions are made without including folks with lived experience. The voice, the knowledge, gives us direct contact. Yeah, so I'm really seeing that there's some buy-in here of the folks at this table, which again, I appreciate that hearing from folks with lived experience is really a key piece to how we achieve that vision. So I'm switching questions here. And I want to ask, based on the visual, where's your agency at right now with in terms of partnering with parents and caregivers? And I'm actually going to clear these quick because I think this was from the last presentation I did. So I'm going to have you re-answer here. Are you either thinking that you are at the engagement level, so sort of that one directional piece of family engagement, or involvement is, again, we're sharing some power, but it's still being controlled quite a bit from like the organization or the formal setting? Or are you at the partnership level where you're really ensuring parent leaders have a true say in what happens? And of course, I'm not sure how many folks are here from like a different lens where they say it might not apply to them. So feel free to answer that too. And then I'm not sure. That's totally a fair answer. So we have over 300 people on this call. So I'm going to wait a minute till these numbers get a little bigger so we see where people are at.
I definitely understand now, Andrea, in our other meetings when you watch it move, I'm like, ooh, this is so cool.
Isn't it fun? Seriously, I love this donut one. It just really moves and it makes it a little interesting. Seeing a pretty even spread here. All right, I'm going to talk about the next slide here of why lived experience matters, but feel free to keep answering this and I'll pop back to this one and see where we end up with where folks are at. So here's the why of this presentation. There's really three main whys that I like to present on, but I know there's plenty more for sure. And like us, most places have those values of supporting families. And as a former case manager in child welfare, I was really motivated by my values to keep kiddos safe and help families to provide supportive relationships. And when we have lived experience take the lead, we're living our values of self-sufficiency and advocacy. So that's really us embodying what we're here to do. The other main point is about outcomes. Though there's not a lot of research on this topic, Joyce Epstein is a great resource that shows that outcomes are really improved when families have leadership in the system. And there are plenty of family leaders like our two panelists who can offer that qualitative explanation of how involvement has changed systems, programs, and policies for the better. Just like that example of the listening session, programs, activities, and policies have all been made better when we authentically honor that perspective of those most impacted. And then representation is really, for me, the big why here. There's all kinds of expressions to capture this thought, like nothing about us without us. And it's easy for any of us with the best of intentions to not prioritize the issues of others if it isn't directly impacting us. We're seeing reckoning with this right now as a society, that those in powers are making decisions. And if those in power aren't living and breathing that experience, it's really easy for them to not take it into consideration when making decisions. So for folks who wake up every day and can't turn off that experience they have, their perspective is critical to move the needle on equity. So time for my panel again to share, why does it matter to have lived experience partners at the decision-making table? Why is it different to be there consistently at the table instead of just providing feedback here and there? Jane, yeah, go ahead.
For sure. I think having lived experience representation at the table is so important. Like, I can't emphasize that enough, because like hearing a story from one person directly versus hearing it secondhand changes everything. Like, parents can speak to how they see mental health in their children, but the children are living through that on the first hand. So it's just a different perspective. And I think providing a safe, inclusive space to do that is important. I know like when people would talk about my mental health, it didn't feel right because it was my story and they didn't necessarily have that permission or that communication with me to share that. And it wasn't necessarily the same impact that it could have had. So communication and permission, I think, is so crucial to when discussing mental health and advocating for that, just so everyone's on the same page.
Well, and I hear the power in it too, that like when you share it as your story, it's different than if like a therapist or a worker or school staff shares it on behalf of you. Like it's just so much more powerful when you share it directly.
Yeah, definitely.
Yeah. Thanks for sharing that. Rachel, anything you want to add in here of why it's important to have lived experience at the table?
Yeah, so I have a master's degree in counseling, and I went through 2 internships, school counseling and clinical counseling, and I was shocked by how many things I did not know and was never taught in school and was never taught during my internship. And as a clinician, sometimes you feel like you're kind of thrown to the wolves. And then when I started actually having all of this lived experience with my own children, I had so many aha moments, and it was easier for me to help my families because I truly understood where they were coming from. I think that we need lived experience at the table so that we can learn how it really is. And if we understand what challenges families face in their recovery journeys, we're going to be better equipped as a field to help all families navigate that journey successfully.
I love it. So powerful. Thank you for sharing that.
Well said, Rachel.
Mm-hmm. And so, okay, this is the name of this whole presentation, so it better be good. Where to begin? Where do we want to begin if we need to support lived experience leadership? It starts with you. So before we just hop right in and start calling up parents to come to our focus group or to show up at our next committee meeting, I encourage us first to do some reflection as individuals and as agencies and as systems. So we're intentional about our efforts to partner with lived experience leaders. So first, I really encourage us to examine our readiness, and do we believe that families have strengths to offer? Are parents complainers, or are parents providing informed solutions? Do families not understand the systems of mental health, or are families knowing the system from the ground level? And then are the young people that we work with not caring, or have we not tried hard enough to partner? And here's the thing, there isn't just always a yes or no answer to these questions, right? Like there may be some other biases that get in the way of our opinion of some parents or young people. But as you'll hear from our panel, those little actions can have major impacts on how families perceive you and your system. So from here, I want to ask the panel, how can you tell when a worker or organization has a negative view of families or parents? And how can you tell when a worker or organization has a positive view of parents or families? So if either of you feel motivated to share, kind of like how can you tell their perspective that they might have on families?
I have a lot to say on this one.
Let's go, Jane.
So I guess like when a worker or organization has that negative view on a family, there tends to be a lot of judgment or lack of help. Personally experiencing this with like the foster care system, like when caseworkers, the children are in need of a resource or something in services, but it could be even an emergency and the caseworker won't assist. And don't get me wrong, I know caseworkers have a ton on their case. However, it's still really important to get these kids what they need. So as foster parents, we're advocating and like communicating all these higher needs that they are getting, but caseworkers just wouldn't listen. And that's where our system is broken. And we're letting these kids fall through the cracks. Caseworkers would constantly like just miss meetings and not communicate with us. So I was like, well, I'm putting all my time into this, but then nothing's happening. Lies were told to all the parties involved. So like a ton of extra documentation would just need to be taken part. It was just really disaster. It was just like a crumbling disaster and not helpful. But at the same time, it can be really challenging when trying to get foster children like appointments, because we don't have that legal guardianship of them. We just have like, here's a paper, they're in your care. And so just trying to get them to be like open with us and like, hey, we're taking care of this child. We just want them to be safe. Not necessarily needing everyone to be rude because we're foster parents. But at the same time, on the positive side of this, like going to appointments, it's so appreciated when doctors give us information that we do need, or like extra documentation so we can give to the bio families or the caseworkers, because then everything is listed. We all have that open communication. Everything is on the same page. But I appreciate when people don't also assume like, you're the biological parent because you have the same skin color as the child. No, that's not how this works. Like, I don't, and they expect me to know like the child's history. I don't know, they've been in my care for a week or a month. Like, I don't know them. They're still learning. I'm still learning what food they like. So just really being patient and open about that just adds a whole new level of respect, I guess, because that whole kind of actions to show the staff and the organization about parents and caregivers come first. And like, we obviously are there to help the children and advocate for them just to get what they need. So
Yeah, thanks for sharing that. And again, to me, that's just, I'm hearing loud and clear those little experiences that families have, particularly your family with the system. Like when you get shut down and when you get the runaround, like that's when you're like, nope, they don't have a positive view of me and they're not interested in hearing my perspective, all that kind of stuff. Yeah, Rachel, I'd love to hear from you.
Exhausting too.
Yeah, totally. I believe that too.
I perceive a negative view when there is things like jumping to conclusions, if there's any sort of perceived condescension. So that whole power imbalance, right? Therapists and social workers, they're the expert, and the family is who needs the help, right? But that feels really, really yucky as a family, and it makes you feel like your perspective is not valued and your needs aren't really that important. And that deficit-based language can also be a really big blockade. Positive view, if I see active listening, if I see the other person demonstrating empathy, if there's an attitude of collaboration, if language is strengths-based and empowering, those are some of the things that I look for.
Thank you. That's really concrete, and I think folks are really going to appreciate that perspective. So thank you. So here's our next thing to examine. And it's honestly something we should always be cognizant of. Like literally my full-time job is to support and amplify the voices of people with lived experience. And sometimes I feel myself getting nervous about seeking their feedback. Even though we approach them with the best of intentions, sometimes we get it wrong. And sometimes we feel stuck in the system we're in. And so we know that their feedback is valid, but we also don't feel like there's room for change. So we can provide that opportunity for families to share the injustices they have experienced with our system. Sometimes it can sound harsh, but we really do need to hear that straightforward perspective. But it takes some internal consideration, both as a person and then as an agency and as a system, if you're really ready to hear where your system needs to improve. And then again, here's really where it gets tricky about sharing power. How do we strike that balance with content experts and context experts? How do we move past tokenism and checkboxes and move towards partnership? Really, are we partnering to review plans we've made, or are we partnering to build a plan together? Are we having a one-sided conversation, or are we prioritizing discussion and follow through? There's not really a one-size-fit-all answer for how to do this shared power, but we will, in the next couple slides, be taking some time to think about what are some steps you can take to kind of break this down. But I do want to check in with our panel again of how can you tell that an organization or group is really open to hearing you and sharing power with you? What does that look like, feel like, sound like? Another big heavy one for this Tuesday morning. Rachel, thanks for volunteering first.
So, I mean, it goes back to a lot of what I was just talking about, where if they're showing active listening and an attitude of collaboration, if they're using empowering language, not treating themselves as the expert, but more, you know, having more of that equity at the table. And then another thing that I really like to see is an attitude of curiosity. I think that's really, really important. Even if you don't know how to help and you don't know what to say, the fact that somebody is curious and can show that they're curious, that all by itself feels empowering sometimes.
Yeah, it's those little things, right? I totally feel that. Thank you for sharing that. Jane, what's coming up for you?
So I think it's really important for them to just be successful and open. My wife and I have a lot of experiences on this. And I have like 4 points here, so just bear with me. My wife and I are foster parents, and like we've really been struggling through COVID with everything just being shut down because we had 2 placements with us that were a set of siblings, and one had a lot of higher needs, and that came out a lot more with the trauma during COVID. But we literally lost like all of our communication and support. Like we weren't able to go to church. We weren't able to have that community. We didn't have any communication with like caseworkers or our therapies because everything was virtual. And the oldest one, he just turned 4. He was just like, he was triggered by screens. He was triggered by the shutdown. Like he was just staying home. And that was really hard because we didn't have any support. And it was a lot of like 24/7 supervision. So at that point, we literally just felt like our world was like crumbling all over again. But on the bright side of that one, like I saw a post on Facebook, I think it was, and like someone was just asking, how can we help you in this time? And it was just a church, and they were providing meals, and they're still providing meals for us because we're pretty much still like quarantined because we're all immune compromised. So that was really helpful. But we've also had a few caseworkers where they were actually doing their job or they were on their game, and they were willing to actually communicate and find ways to help, whether that's just like bringing gifts or things to occupy the children, things like that. So that was really helpful. We've had doctors tell us that like nothing is wrong with the children, even though, you know, kids would stop breathing overnight, and that doesn't really fly. Like you need the kid to be breathing. So I think just like it's not necessarily saying that there has to be a problem, but something's going wrong and that needs to be brought up. But for me personally, like looking into organizations and just having that be heard, when people listen to my concerns and my suggestions, like feel like I'm actually having a voice. I'm appreciated for being here, and just being able to share my experience again. Like I said in the beginning, I want to advocate. I want to be here, and I think that's really important to have that, again, open communication.
Yeah. Well, and I'm hearing the follow through is a big piece of it too. Like listening is a piece of it, but then like doing something about it is kind of the other big piece. So yeah, thank you for sharing that particular perspective. So I will, after, like once we get to Q&A, I'll go back to that slide where we had, where everyone was rating, are they in engagement or what level? But I do want to do one more quick check-in of how we're doing so far. Are we feeling engaged and listening? Are we following all of this? Or are we feeling a little lost? Are we having major questions? Again, if I was in a room with everybody, we'd be able to see a little better how folks are participating. So just want to get a quick read. And for those who are feeling lost, keep submitting some questions because we'll be able to clear some stuff up in just a few minutes when we get through the presentation. Okay. I appreciate this. So I'm going to keep scooting along. And so I'm going to put up another question in just a second to keep doing a little bit more reflection. So here, you know, I've been making you do some work as well. And I'm hoping that we can start to think about what could shared power look like in your work. Knowing that we've seen that lived experience, our visions are aligning and our values are aligning, what could it start to look like in the work that you do? So I'm going to leave this question up for you for a little bit, and we'll keep walking through a little bit more of the how in this presentation. But I love that people are answering already. That's great. So There is a handout that we've provided with this presentation that can walk you through some of these planning questions. But I really do recommend just to start to map out this project and to provide some clarity on the who, what, when, where, why. And ideally, you're setting up this structure that's kind of formalized for folks to invite them in, but you're also creating it with flexibility to let people participate to their ability. Because again, stuff comes up for families. There are sicknesses or there are other, some folks are still working other jobs and participating in these advocacy roles. So we really have to remain flexible with our asks for folks. The second thing I would really emphasize here is to plan ahead and make sure that you have some kind of support person identified. It does not have to be a full-time employee, but just having that safe and trusted person as a main point of contact helps to keep this kind of partnership going. And so with that person, ideally, they can just kind of be open and talk without all the jargon and all the intensity and just really be like, hey, who is this person? Or hey, what's going on here? I'm confused. So having someone who can be that support person is pretty critical. And then my last big point here is honoring time and expertise. And really, when I say that, I'm talking about money, stipends, gift cards. This is really showing a level of commitment and changes that power differential in the equation. If you were to ask, I generally recommend $15 to $20 per hour of meeting and participation. But ultimately, this is a space where sometimes we're confined by the organizations we're working for and what kind of budgets we have allowed. The other thing I'll say is that there are a lot of people who do this work for free. A lot of folks who are just motivated by their passion to help benefit other families or, just want to see the system change. But money is a way to make it more viable for them to participate. So if you don't have a way to honor their time and expertise with some kind of incentive, don't let that stop you from seeking out lived experience leadership. But again, as an advocate over here, I would continue to say, ask and keep advocating for that kind of support for families who are participating in this work. And so now as a question for my panel, we're talking about mapping out the project, the who, what, when, where, why. What are those key things that you need to know before you say yes or no to participate in some kind of leadership activity or these committees that I ask you to serve on? Like, what things do you need to know before you say yes or no?
The number one thing for me is being very, very clear about the commitment of time. So what is my schedule going to look like? How many hours are you asking of me? Because I do work and I have all these things going on at home, and we need to be really careful that we're not putting families in a position of burning out because there's too much on their plate now. So I think just being really transparent about what is this process going to look like and what do I expect from you, and being very clear about that from the beginning.
Yeah, I really agree. Time is huge, just knowing my schedule, because again, we all have lives, like we can't always make things priority. But making sure like there isn't necessarily like a hierarchy in the meeting or the group, because that kind of takes away from where the voices are heard and the perspective. And if you really do want lived experience at the table, we need to hear their voices and their experiences, because that's what's making it happen. I know it can be a little tricky with confidentiality, but we do need to support, like, again, these are their stories, and keeping that like kind of in the room unless you have their permission. Just having that open, non-judgment, inclusive space.
Yeah, well said. And Rachel, the one thing I want to piggyback off what you said around time being so important. I know as a worker who's asking for families to participate, we have to give them enough leave time to say yes or no to something. So again, just like full disclosure, Jane was running into an issue last week and was like, hey, I don't know if I can make this conference. Again, so grateful she's here. But I was like, well, I don't want to just stop and ask if somebody else can fill in her spot like 3 days before the conference. Like, that's not fair. That's not appropriate amount of time for someone to prepare. And so like, just always being mindful of that too. Like, you can be straightforward with the ask, but like just giving folks some time to think about it and make adjustments and prepare on their own is a really important part to this process. So the next big piece is finding those partners who are going to be at the table with you. I often get this question a lot of like, where do you find families? And if you're a direct service provider, honestly, you have your folks right there. You know, think about the folks who have a lot to say or those who really don't and have been kind of disengaged. Both might have an interesting perspective to bring of why they've been so engaged or why they are really like dismissive or standoffish. And then, you know, I really say like be intentional with the getting to know them and asking the right questions. So, you know, for me, I'm asking when I'm first meeting with somebody to decide if they'd be a good fit to join committee work, I'm asking about their strengths, what gets them excited, what drains them, how do they handle a slow process, how do they prefer to receive feedback, what's the goal for the bigger system they're a part of. It helps to know their story too, but there's so much more than just that story. And so really it's a different way of engaging with folks. It's not, those questions aren't necessarily the same things you would ask if you're in a home visiting program or you're engaging with a parent. So asking them to participate in system change work means we kind of need to get to know them on a different level. My next piece here is really building preparedness once you identify those folks to help. And so again, authentic relationship building is really at the core of this, but just more on the logistical front, providing some kind of orientation. It doesn't have to be a big formal, here's a PowerPoint, but like just speaking candidly about the formality of the meeting and giving appropriate expectations, really making sure they understand the history of the project and the structure, and also breaking down that complex language and jargon. Introductions with key people, again, really identifying who are those main folks who should be kind of chumming up with or like are influential at the table. And then really just reassuring that their perspective is needed and wanted, because again, it's really intimidating to show up when you're one of the only family leaders at the table and you have a lot of other folks around the table who have letters behind their names or are in positions of power. It's easy to be like, oh, never mind. Like, I'm good. I don't want to do this. So really providing that affirmation actively and ongoing is key. And so then question for the panel of how can staff and meeting attendees support you and your ongoing participation in a committee or group? What makes you feel safe and ready to actively participate in a committee or group? Oh boy, another big question. I saw Rachel unmuted first. Go ahead.
I think honestly, it comes down to the little things for me. So there are times where, especially if I'm joining a new committee and I don't know anybody yet, it is very intimidating. Like, and I have letters behind my name and it's still intimidating because you don't know what they're talking about. You don't understand that specific system or what's already going on. And honestly, the biggest thing that has helped me is just people like Andrea drawing me out, inviting me to speak, thanking me for sharing my perspective. Those little things really, really matter.
I'll take that praise. Thank you. But again, I think it's important. Like this is just the way to do it. So yeah, thank you for that. Jane, what you got?
No, definitely. I completely agree with Rachel says, and I love Andrea. She's so supportive and always checking in with us. Like, it was a rough meeting. Let's talk. But honestly, like, it is really just like when I first joined this work, it was, I'm just going to sit back. Like, this is a lot. There's like 40 people at this meeting and I'm just a newbie. Like, I don't know anything what's going on. So I would sit back and just observe to start. And then once I did feel confident, like I'd be sending notes afterwards. I was like, I felt this still. But then later on, I was like, I can speak for myself. I got this. And then I would ease into that. And I think it was really important because I had that different perspective. But I like to sit back and just learn from others because again, I don't know everything. So I think that's really huge.
Yeah, I appreciate that. And honestly, when I provide orientation for our lived experience partners, I encourage them to sit back to start. Like, don't feel like you have to just all of a sudden start spewing off stuff. Like you're still getting acclimated. So don't feel like you need to sit right there and like have the right answers to everything. Rachel, it looks like you might want to say something.
I was just going to say that I think that also helped me that there was a process of kind of working into it. And so for me, what it looked like is we have this app that we use at OCMH called Slack. And so I was able to instant message Andrea during those first couple meetings and ask her my questions if I didn't understand what the heck they were talking about. Or if I was a little intimidated to ask it myself, I would ask Andrea, and then she would find a way to like, hey, so we have some parents that wonder this. And then after I saw how receptive the group was, then I felt brave enough to ask it myself. So I think it was really nice to kind of have that process to like Andrea said, acclimate, that's a good word, instead of just diving right in, because that's intimidating.
Totally. Totally. And so then my last big piece here with the where to begin, again, it's sort of what they were just speaking to, that support in action. And really the big piece I like to emphasize here is connecting people's points to system change. Like, I think in the work that I've seen of bringing families and young people to the table, sometimes they will feel empowered to share. And when they share, it might just sound like a story that they have. And like, you know, this is a few years ago, this is what happened with me and my family. And like, they'll tell that story and I can see other people in the room be like, why did they just say that? Like, what did that have to do with what we were talking about? And like, it's really on us, the rest of us around the table, to like help make that connection, that like they are bringing it up to connect to some kind of system change. And it's up to us to also help make that connection more clear. But otherwise, asking probing questions to continue understanding. Like, I'm curious why this is important to you. What does getting X mean to you? Tell me more. That's like my favorite statement to ever say. And then just another thing to say here, again, regular check-ins. A model that's worked really well for us is pre and post meetings. So creating some space ahead of time just for the family leaders to connect and kind of look through the agenda, make sure we're squared up, we don't have questions. And most especially the post meeting, where it's like, okay, what the heck were they talking about at this point? Or like, man, who is this person and why did they seem so grumpy? Like, it's easy to kind of like break down what's happening in the space when we have some just protected post meeting time. And I'm looking at the clock. I want to check back in with what could shared power look like in your work. You know, yeah, not sure, but just asking the question with our clients is a great first start. Totally agree. Yeah, parents created goals and outcomes, taking that time to listen, parents being in power at the beginning, asking open-ended questions and giving them the opportunity to share what their needs are. Totally. But I also saw at the beginning of like the fact that families participating on committees and meetings is really a good next step for how shared power can look. So in our last few minutes, I just first of all want to say that some kind of key takeaways you can have here is identifying those themes and system improvements that you're hearing from clients and that you're hearing from families, and bringing that to the powers that be in your organization or in your system. You can advocate and lobby for policy and legislative changes. Again, I recognize not all of us are lobbyists here, but like all of us also have a phone to call our personal person who's in charge of like our district or our representative. Identifying more people with lived experience is a really great next step. But so is tapping into the lived experience that you all have and telling your story too. I think we've seen overall that kind of engagement can really bolster relationships with folks that we serve. And so then a last couple of reflective questions here. Just be thinking about the ways that you personally have power in your organization and how you could share that power with the clients and folks that you serve, and what might look different if clients had more say in your agency. And a year from now, where do you hope to see lived experience leadership in your organization? I've been a middle manager in a small nonprofit in the past, and I know that sometimes it feels like changes are kind of like out of our grasp because our leadership won't be on board, but know that there are still ways that you can influence and change your work. So I see it's 10 o'clock. The last things I want to say is that I'm going to hop onto my next slide and just say, if you want to share, oh, let me clear this quick. If you'd like to share your name, email address, and things you'd like to connect on, I can't send around like a piece of paper like I normally would. So this is my virtual piece of paper. And so if you're not really sure, but you just want to connect, share your name and your email address, and I'll follow up with you. So I'll leave it there for now. And I see that Jenny's back online. So I'll pause for that and just say thank you to our panelists and thanks to everyone for listening.
Thank you, Andrea. I have a few questions for Andrea and also for the panel for you to kind of talk about. So one of the questions that we had was, what are some good communication methods, ways to respond and get in touch with families, especially since it's such a busy world that we live in? What have you found to be the most helpful in communicating with families?
Yeah, I'll start, but I will want to see if Jane and Rachel have anything to say. Rachel mentioned that we use this application called Slack. So when I do have folks who are signed up and say, yes, like I want to serve in this advisory capacity, I orient them to this application. And Slack is pretty much like, think about like Facebook Messenger or any kind of messaging app that is just like a long history of what everyone has said. You can share documents, you can like direct message people. So we use that platform quite a bit to like just keep an ongoing connection with all the family leaders in this work. But in terms of like just individual connecting, that's another question that I ask when I'm like doing that initial onboarding is like, what's your preferred method of contact? Is it texting? A lot of folks like to text, so I do that. Is it email? A lot of folks just like to keep all their kind of like professional stuff in their email inbox. So a lot of folks I email. A couple of folks like to talk on the phone, so I do that. And honestly, I just have a spreadsheet behind the scenes that I'm like, okay, I know Rachel likes to do email, and I know that Jane likes to do Slack, and I know that Rob likes to do phone calls. So like, honestly, that's how I kind of keep it straight. And I think it really just has to do with each person's preference. But the other big thing I do is I do like gentle nudges or follow-ups. Like if it's been a few days and I haven't heard, I'm just like, hi, reaching out again, like, which I know is pretty common in this world of like case management, but just, yeah, a little nudge never hurt nobody to be like, hey, did you forget? Or, hey, I don't remember, did you respond or not? So those are the thoughts I have, but yeah, to Rachel or Jane, any other thoughts on like messaging and communication, what might work best?
Yeah, I think it's just really important about what their preference is, because like if you're not going based off their preferred preference, like they're probably not gonna like keep in contact with you as much. And I'm that person that loves to build rapport with kids or with individuals. I almost like kid because my kids is next to me. But like I think that's super important, and I lost my train of thought. But
you got a baby with you, that's okay.
But yeah, go ahead.
Sounds good.
I agree with just the preference thing. I am a person that even if something is important to me, I will not answer my phone, and I will probably never call you back. That's just how my world is. My kids are loud and it's chaotic, and I don't like talking on the phone anyway because my face always like messes with the buttons, and like I just won't do it, but my phone will ding when I have an email, and I will look at it. And if it's from Andrea, I will read it right away. So I think that's just really, really helpful to know what each individual wants, because there's really not a better way to maximize your success.
Awesome. So Jenny, what else you got for us?
There's another question that are kind of tied together. So some participants are wondering how to handle a situation where you invite these people to the table and they're sitting with you, but others in the committee either disregard or dismiss their input, or they're not bought into that. So do you just want to talk a little bit about how you work with your committee team to share that lived experience with everyone?
Yeah, I'll jump in, and then again, Rachel and Jane, if you have anything to add. The first thing I'll say is that there are a lot of formalized like trainings for committees or councils to like be more open and receptive. So leading by convening is one of the leading trainings that folks can participate in as a committee or a council. to kind of understand why lived experience perspective is really important. So, you know, I might recommend doing some sort of structured like info session of like, this is why lived experience matters. Like it's sort of what we talked about here today, like providing that sort of baseline for folks. But otherwise in the process of a meeting, a lot of times it helps to be someone like me who is both tapping into a lived experience perspective, but is also there in a professional capacity, because I still have that like implicit power being at the table to say, oh, hey, you know, I don't think we answered her question, or like, I don't know that we really got back to this topic. Let's circle back. So like really trying to like draw attention or take the space from the committee back to the main point that family leaders are bringing up, I think is an important step. And aside from that, I think just trying to, again, just to say to the room, this is why we have family leaders here, because we recognize we don't know it all. And like, I think there's been a lot of movement in the consumer movement to say, hey, this is why we need to hear from them. But just having that buy-in at the leadership level is really going to help you get further. I'm going to pause and collect my thoughts a little better, but I want to see if Rachel and Jane have any other thoughts of like how to help folks who are at the table take in what you might be saying. Anything coming up?
Not so much on that, but just in response to the initial question, I know for me, and this is a sad reality, I've come to expect people to not really care about my opinion and to dismiss me. And so even having one or two people at the table who are validating, so like in this particular organization, Andrea is the one who really takes a lot of that on. But even just having one person validate what you're saying and thank you for saying it, or try to bring it into the group, that is really, really helpful, because honestly, I'm so used to being dismissed that if I had 9 people at the table dismissing me and one person was like Andrea, I would still be excited to be there. So yeah.
Yeah, very much. I know like in some of our meetings, like I know Andrea touched base about it a little bit earlier, like having those pre-meetings and post-meetings, because like in some of those bigger meetings, not everyone obviously gets the voice to be heard. And so having our thoughts expressed prior, so Andrea is that voice for us usually, and then she's allowed, or she advocates for like what our voices were saying in the pre-meeting, and then we talk about were those actually meant in the post-meeting, and like that again just makes me feel validated and advocated for if I'm not able to do that myself.
Yeah. The other thing I thought of as I was thinking about the structure and how we can help to bring in their voices too is, so again, pre and post meetings and during meetings, you know, I'm hearing what folks have to say, and then I get to help be a co-chair as well to these different committees. So I'm bringing back what they said, you know, like if Jane at the Trauma Informed Care Committee was saying, hey, we really should be thinking about schools, then when I'm back at the co-chair meeting, even though Jane is not in that co-chair meeting, I'm saying, hey, and I want to just bring it back up that we talked about schools, right? Like where are we going with the schools thing? So like just trying to like bring back those ideas that might be pushed to the side, and just making sure we're continuing to refocus that.
And one other question that I'm curious, and I know you mentioned like gift cards and other ways to encourage participation, but do you have any other tips to kind of engage families in conversation? Someone just commented that they offer this engagement for families to be involved, but sometimes there's little participation. So I wondered if you had any more tips for that.
Yeah. A big part of that is going to be system by system or like organization by organization. But I think the biggest takeaway I've had in thinking about like getting feedback from families is making sure that there's something in it for them too. So like sometimes what's in it for them is like coming together and meeting with their peers. Like like if you would bring together a group of families to say, hey, we'd like you to come talk and share your perspective, but also you all connect. What they get out of that is those shared connections with somebody else now, like they got to meet somebody new. So I think that there's the side of it that like from our ask of whenever we're asking of somebody, there's some kind of incentive. So it could be new relationships. It could be around food. Like food is often a pretty good incentive. Again, in this world of COVID, we're not meeting as much in person. But I think then otherwise being really clear of this is how your feedback can help change big stuff. I think that when we can make it clear that it will have follow through and like then following up with them after and saying, hey, you answered XYZ in this survey. Here's the changes we made because of your answers to XYZ. I think that will start to build that more folks will be bought in and get involved when they see that other family members are being involved and that action is actually being taken. But I'll see if Rachel and Jane have anything to add to this too, of like, how can we get some folks engaged if we make the ask and they may not be totally in to start with?
I agree with what you just said at the end there. I think for a lot of parents in situations like this, we are very drained, we are very, and so you really need to draw out that passion. And I think there's probably no better way to draw out that passion than to show, hey, this person participated in this way and this was the result. Like that is so powerful. It provides hope. That for me would be motivating all by itself.
Yeah, I mean, I just agree with that. Just the personal check-ins to see where people are at. Like, if it's been a few months and they haven't said anything, or just a couple meetings because they are fairly monthly, like just having that check-in to see where they're at or if something really is going on that is like distracting them from that bigger work, and just kind of discussing that and making sure that people are there and know about it. Like, again, that concept of like not being alone.
The other thing I just wanted to quick mention too is that our website does have a lot of other resources that might be helpful or just more information on lived experience, both from the family leader perspective and from like the organizational system perspective, wanting to bring folks into the work. So please look to this as a resource or look to me as a resource or any of these awesome people. We have a lived experience group that meets monthly and we'd be happy to provide some insight to your work if you're looking for family engagement. Like we always are available to provide feedback, insight, whatever that looks like. So just putting ourselves out there as a resource as well.
Awesome. Andrea, we have just a few minutes left and I have two questions just to kind of wrap up. So
sounds good.
One being, what is the usual timing for your pre and post meeting follow-up? And then also any challenges that you faced in bringing family leadership to organizations. And if you have any last minute strategies, we have 1 minute just to kind of wrap up.
Okay, you might have to say the second question again, because the first question for sure is I usually offer 30 minutes pre, 30 minutes post. Ultimately, it ends up being more of like 15 to even 10 or 5 minutes pre. I think usually people are receiving agendas and knowing all that. So they're just like wanting to do a little check-in before we get started. Post meeting, usually 15 to 30 minutes is what folks need, depending on how rambunctious the meeting was or how many folks we're hearing from. So that's my answer there. And then I'm sorry, Jenny, can you repeat your second question?
Yeah, absolutely. Just a question, if there's any specific challenges that you faced in bringing family leadership to organizations, and then strategies to address that challenge.
Yeah, I think that actually the world of COVID with virtual meetings has made a really big difference. Before this, a lot of times folks were running into challenges of transportation, and trying to find the logistics to make it accessible. But now that everything has really moved to virtual meetings, I think it's a lot easier to invite family voice because most people are able to connect either by phone or by an online meeting. So I think that's removed the biggest hurdle. And then otherwise, yeah, I think it's just folks aren't aware that there are opportunities to serve. So like there are people who are passionate and they want to participate in stuff, but they don't know that there's a committee that wants to have their voice. So the more we can offer that, I think the more we'll get over that barrier.
Thank you, Andrea and Rachel and Jane for sharing with us today. I'm excited to look at your resources. I echo there were so many comments in the chat that they are just acknowledging how awesome it was to hear from you all today. So thank you for joining us. The session will be recorded and then will be available in the upcoming week if we want to go back and check it out or share with others. Also, there was an evaluation link that was sent out in your conference connection page this morning. We value your feedback and want to hear from you, and we will be sharing that with our presenters as well. So please fill out that link for us. Enjoy this little break that you have, stretch and breathe. And we will welcome you back at 11 o'clock today with our next session, The Power of Presence, attuning to our own self-regulation skills. Feel free to check out our website in the meantime. If you want to support what we are doing and you're really excited by all the content that we are offering, feel free to become a member of our organization as well. Thank you again for sharing today, and we wish you all the best.
Thank you. Thanks everyone for listening. And thanks again to our panelists.